Cheryl Bishop was born in Prince Albert, Saskatchewan. She went through school and graduated from high school in the Vancouver area and went on to complete her degree in pharmaceutical sciences from UBC. Soon after graduation, Cheryl moved to Brantford, Ontario to work in pharmacy. She also took a pharmacy residency at Toronto General Hospital. Continuing to advance her career, she accepted and excelled in a variety of positions at the New Markham Stouffville Hospital. During her time in Ontario, she was recognized for a number of awards. Cheryl made the big move back to Vancouver and joined the team at Providence Health Care.
I came to St. Vincent's in 1998 as the director of the pharmacy service. Soon after, I was very excited to be given the position of director of the surgical program and later also maternity services at Providence Health Care. I so enjoyed working with the surgeons, anesthesiologists, and operations leaders in the surgical program. Also so rewarding was working with maternity services, knowing we were bringing new life into the world.
It's a great honor to be part of this nomination for Cheryl Bishop. Cheryl really did bring her best game to work every single day. And one of the things that I will always remember and learn from Cheryl was about how to build effectiveness into achieving your results.
Cheryl Bishop was a program director when I was a staff nurse here at St. Paul's in the operating room. And she was instrumental in my development as a leader here at Providence. She encouraged me to tackle different positions.
I met Cheryl Bishop when I became department head for surgery at St. Paul's and Mount St. Joe's for Providence a number of years ago now. She was the we called her the boss. She was running the business side of the surgical program, and I've known her ever since then, and I'm very pleased that I had an opportunity to work with her my time as department head.
So Cheryl's been really instrumental in my career. She was the first person in Providence Health Care that put me in a management position. And not only did she put me in a management position, she helped really form my thinking around management and good management practices. And what is great about reporting to Cheryl is she likes the detail and she asks a gazillion questions. And so nothing gets by Cheryl Bishop.
It was a pleasure to work with Cheryl from the perspective of always feeling that there was a positive energy in the room and that something good was going to come out of this, even if we were in a bad situation. The days that Cheryl did have a frown on her face really always made me worry, because she was like the temperature for the organization.
So as hard as Cheryl can be in meetings in terms of details and wanting to know all the facts, at the end of the day, Cheryl, I always felt, really cared about me as an individual.
If ever there was a difficult issue that we were discussing, she would always come up with the question, well, what is best for the patient?
When we talk about being driven by compassion and social justice, that was Cheryl. That's why she spent countless hours on the phone and down at the Crosstown Clinic and doing everything she could with Health Canada and with the College of Pharmacists to make sure at the Crosstown Clinic we were able to continue to deliver medication to patients who desperately needed it, and she would stop at nothing.
I would just like to say thank you to Cheryl for seeing in me what she saw, for giving me the opportunity to grow and develop and have a fulfilling and rewarding career here at Providence. So it makes me misty, but we miss you, Cheryl, and happy retirement.
As I go into my retirement, I will not only miss my career, I will especially miss all of you. Thank you so much for the Faye Meuser Award. I am honored to be the recipient this year, and I will treasure it.